Hello and good evening to this special broadcast where we will be discussing how to deal with the COVID-19 pandemic, the second wave of it in India. India is presently reporting over 3 lakh cases every day and over 3,500 cases daily. Here to make sense of the pandemic and also give you all the information you need to ensure you and your loved ones are safe. I have with me Dr. Vijay Lakshmi. She's a senior consultant infectious diseases at Kauvery Hospital. Also with us today is Dr. N. Sridhar, who is a consultant intensivist, head critical care at Kauvery Hospital. Both of them have been at the forefront of dealing with the COVID-19 crisis here in Tamil Nadu, in Chennai. So thank you both for being with us today and taking time out to basically explain the situation and the gravity of the situation to our viewers today. I will get straight right to it. Dr. Vijay Lakshmi, if I can start with you. Firstly, the basics. Of course, this is the second COVID wave that we're dealing with. What are the COVID-19 symptoms that you're seeing in this wave? Is there any change in the clinical manifestations of the disease that people should watch out for?
Well, it's the same as before. Basically, somebody comes with fever, can just be a fever with some respiratory symptoms like cough, cold, fever with some kind of the GI symptoms, fever with diarrhea, fever with headache, body pains. Some people can have rash. Some people can just present with loss of smell and taste, not much of fever. Some elderly people can just have tiredness, not able to eat, extreme weakness and fatigability. The usual symptoms which we saw last time, we are seeing in an exaggerated form. We are also seeing some uncommon symptoms which we used to see in smaller proportion, much larger now. More of rashes this time, lot of upper respiratory. Some of them are presenting post-vaccination with sneezing, cough, cold, which was quite uncommon last time. They don't develop a severe pneumonia, but they have upper tract symptoms. So more or less the same symptoms, but larger numbers.
Okay, all right. Dr. Sridhar, if I can come to you. Given that across the country, especially in Delhi, Bengaluru now, and in Mumbai, there's an acute bed shortage and oxygen shortage. When should people actually go to hospitals if they present with these symptoms?
I think what has happened for the last 1 year is these small handheld devices called pulse oximeters have almost become a must-have accessory. Almost every home has begun to have them, just like we used to have the thermometers in the old days. Now, this is a device we clip onto the hand, and we can look at the oxygen levels. And if your oxygen levels are 93 or less, only then I think you should come to the hospital. If your oxygen levels are 94 or above, and you feel well and you look well to your people who are looking after you, then your care can be taken off at home. As you know, there's a bed shortage, and we should be using our hospital beds, which are equipped with oxygen for those patients who actually need them, rather than for them to be filled by the worried well.
All right. So purely based on SpO2 levels, and that is nothing less than 93 is what you're saying.
That's correct. So 93 and below, we need to come to the hospital and have you looked at. Further tests need to be done. But if your oxygen levels are 94 and above, you can be at home.
All right. Okay. As far as testing goes, Dr. Vijay Lakshmi, when should one actually take a test? Immediately on seeing symptoms, or should one wait for a few days?
Initially, we used to say test on second or third day. Now I'd say within 24 hours, go ahead, because this is an epidemic. Anybody presenting with fever, symptoms will likely to be to COVID, and you need to isolate yourself, because what happens when they have a milder form, they tend to go out and spread it more. So test and treat has been the strategy throughout the world. It has worked very well. So I, for one, believe that test yourself and isolate yourself. The moment you give your test, you are isolating yourself. So don't wait for a few days. By 24 to 48 hours, please test yourself. If you have a doubt about the symptom on day one, separate yourself in a room, wait for a day, and then test yourself. But then testing within 40 to 72 hours at this point of time becomes mandatory, basically for isolation and curbing the epidemic.
I think that's very important, because we've seen a number of people who've taken their tests and then they go out because they believe that they have only a cough or they have only a sore throat. So it's important that as soon as you take your test, or as soon as you know that you have symptoms, possible symptoms, you should isolate yourself. As far as we've seen a number of false negatives come to the fore. We've ourselves reported about it here at the Newsmit. Does it have to do with the RT-PCR kits not detecting variants? And also, what should one do if your test comes negative and you still have symptoms?
See, this
Dr.
RT-PCR
Vijay
test has, yeah, the RT-PCR test has more, not just one primer, it has a couple of other things. So it will pick it up. So if they say, if like, for example, if there is a variant and one of the primers not being picked up, they'll give it as intermediate. They won't definitely give it as negative. So as of now, we really don't have that misere variance which doesn't get picked up by RT-PCR. But remember, every test has some amount of false negatives. So this is a test where you can falsely miss out some patients too. Again, you need to get a swab. The swab pickup rate may be late. I mean, the swab may not have reached the right place. Second, they could have taken it very late or very early too. So there are several factors. If you have symptoms in an epidemic like this, it is very, very likely to be COVID. Unless proved otherwise, anybody with fever, any kind of sore throat, some kind of a cough, severe body pains and lassitude, unless proved otherwise, it's COVID at this juncture. And one negative test with persistent symptoms doesn't negate it. Please visit your doctor or talk to your doctor. Make sure your symptoms are assessed well. If the negative test is negative also, go ahead. The doctor may ask for a CT if there's suggestive symptoms. He may ask for a repeat test, repeat throat swab. He may sometimes ask for some blood parameters too. Go ahead. Please don't decide based upon one throat swab being negative if your symptoms are suggestive.
All right. Before I come to you, Dr. Sridhar, I just want to tell our viewers who are watching today that they can send in their questions and we will definitely take them after the first few initial questions that I have for you. Dr. Sridhar, I mean, a number of doctors that we have spoken to have said that they are seeing a number of patients who are in their 20s and 30s who are basically collapsing after reaching the hospital too late. So how does one really balance this out? The need not to overwhelm the system, at the same time ensuring that you get timely medical help.
Yeah. So we do hear stories about people suddenly collapsing, but nobody collapses in a matter of minutes. Most people who deteriorate over several hours, if not days. For me, I just gave you an objective sign, which is basically using the pulse oximeter as a cutoff and using a cutoff value of 94 and above to either stay at home or come to hospital. The other thing is also how you feel. When you do your day-to-day activities, when you're staying at home in isolation, when you go to the bathroom and come back, when you're taking a shower, when you're brushing your teeth, when you're walking around the bed, do you feel breathless? So it is a combination of how you feel subjectively and also what the pulse oximeter shows objectively. So if you are comfortable doing your day-to-day activities and your oxygen levels are above 94, it is extremely unlikely that you're going to collapse over the next few hours. Whatever breathlessness, discomfort starts to set in, it starts very slowly, it starts insidiously. So you initially are very well, then small activities start to tire you out, make you more breathless, and oxygen level starts to drop. Then at this time, if you come into hospital, it'll be the right time to come in. It never happens that somebody's oxygen level is 90 for 1 minute and then 85 in a matter of next half an hour, 1 hour. It will happen gradually. And it's a combination of both how you feel, the sensation of breathlessness as you go about your day-to-day activities, and the oxygen levels as shown by the pulse oximeter.
Okay, we have a couple of questions coming in. Namita Singh asks, tests are not done, medicines are running out of stock in many states. How does one deal with that then? Assuming, of course, you don't get a hospital bed. Either one of you.
A very difficult question to answer. First, we need to figure out how sick we are. First, a lot of times when you have progressive fever and mild hypoxia starts settling in, you probably have to think about going to a hospital. If you can't, at this point of time, try to see whether you can reach some doctor to assess your symptoms. If you're already COVID positive and you know that you're becoming sicker, hospitalization is always better. Testing and treating is always better. If you can't, there is no way you can treat yourself. You need to get some support, at least by some kind of a conversation with the doctor. Especially because some of us have started, we can decide about giving steroids or not. We can decide about fluid. We can decide about some amount of anticoagulation, how to prone yourself. All these things can be tried at home. But it has to be in consultation with some qualified medical professional. Sridhar, you want to add something?
All right. Danya asks, maybe this. Yeah, go ahead.
No, I have nothing further to add. Thank you, Vijay. You covered it.
All right. Danya asks, I think, Dr. Sheet, you could possibly answer this. We get many stories. 88.
And it's not clear. She got cut.
Yeah. So, Vijay, while we're waiting for Anna to join us, I'm going to be asking a question for the benefit of the audience who can still see us. So, you're COVID positive and you're at home. What advice would you give to people who are isolating at home?
So when you're isolating at home, few things that you have to notice. First, whether you're hydrating yourself well, you can start doing mild breathing exercises, then monitor yourself. So when you're talking about hydration, adequate amount of fluid, because you're not going to have severe pneumonia, 2 to 3 liters of fluid. A good balanced diet, fruits, vegetables, carbohydrates, proteins, that's very important. Take your vitamins on time. If you are given aspirin, please take it and start doing basic respiratory exercises. Deep breathing exercises help a lot. Always could do something called as walking test. 3 minutes of walking, 6 minutes of walking. If you feel comfortable, you're very good. Check your pulse oximeter. Use your temperature and pulse oximeter and appetite. These are three criteria which we use to see whether patients are doing well or not. Temperature which is normal, pulse oximeter showing normal oxygenation, and appetite which is good. If you're able to eat well, very unlikely for you to have progressive disease. If you have problems with appetite, especially because of loss of smell and taste, I would be happy because loss of smell and taste indicates upper tract symptoms. Those with strong upper tract generally do not develop very bad pneumonia. So for you, it may be difficult. For us doctors, we are very happy. When somebody has smell loss or taste loss, it's a good sign. Similarly, somebody having a brief diarrhea, again, you can be very happy because you're probably recovering. If it's prolonged, you're purging a lot, you're vomiting a lot, you need to go to a doctor. Third, a temperature of 199 settling down may not be worrisome. If the temperature is persisting for more than a week, then it is worrisome. You have to go to the hospital. So basically, finally putting into a nutshell, temperature monitoring, oxygen saturation monitoring, and appetite. Somebody is coming. Yeah.
I think Sharon
Danya is coming because Anna has moved
my
out.
role as a host.
Yeah, Danya is coming because Anna's internet connection, I think Chennai is poor connection compared to Bengaluru. So I will be doing the live now instead of Anna. So there are a couple of questions. I will ask the questions quickly. Like the question I have is, a lot of people keep sending us messages saying they have not got beds, that the oxygen saturation is 80, 75, etc. So at what point of time of oxygen saturation should people simply go to an emergency care at least and not keep waiting at home for that bed to be given?
I think any oxygen saturation below 93 is a sign that people can start to deteriorate. So if your oxygen levels are 93 and below, I think we need to start looking for a place where they can receive therapy. I have done some activities with the IIT Chennai, wherein we did some testing on pulse oximeters. We flew to Ladakh to try and find out what are the oxygen levels there, because that's where oxygen levels drop because of the height. As soon as we got out of the plane, our oxygen levels of me and a few other healthy volunteers from IIT was about 86, 87. So at 86, 87, it was very difficult to walk normally. You'd start to feel breathless doing normal day-to-day activities. So I think anything less than 90 is worrying, and you should definitely get to an oxygen center as soon as you can.
So, doctor, you're basically saying that, look, in Chennai, you're calling the GCC, in Bangalore, you're calling BBMP, or in Hyderabad, you're calling GHMC. So even if a bed is not allotted to you, if your oxygen level is dropping, then you should try go to a center and ask for help, right? Instead
Absolutely.
of waiting at home.
Yes. We say 93 to give a safety margin.
Mhm.
Um, Anything below 90 is a time we need to do something about it.
So I think this is very important because people are continuously waiting at home. They are thinking that we have to be allotted a bed, only then should we move out. So I think that's an important point. Uh, the other question we have is from Lely Abraham. She's asking, will the vaccines increase the creatinine level of kidney patients?
I'm not aware of any such uh, side effects of vaccines causing increase in creatinine levels in kidney patients. Uh, I don't know where she got information from. I would certainly recommend it in people who have chronic kidney problems.
Okay. Another question I have is about remdesivir. Now, we keep hearing about, for example, in Chennai, outside the Kilpauk Medical College, in Hyderabad at the Hetero Healthcare, there are thousands of people waiting for this drug. At the same time, doctors are saying, health experts are saying it's not a life saving drug. If it is not a life saving drug, why is everyone prescribing it?
Um, See, I think what happens is, and I have seen it on both sides. One as a doctor treating patients, and I've also seen it wherein my own relatives have become sick with COVID and quite severely sick as well. So what happens is, this is a disease for which we have very limited medications in our armamentarium. The number of medicines that are effective are extremely small. And now once you start them on the steroids, if their oxygen levels are low, and we also started them on some blood thinners, there is very little evidence for any of the medicines. So when patients are desperate and doctors are keen, all doctors' goal is to try and get the patients better under their care, then patients are constantly, doctor, can we do anything else? Can we do anything else? And doctors feel, right, there's this medicine that is available that may benefit them. So let us try it. So at that point, I think they say, well, we could try remdesivir, not that we believe it is going to save lives, but we know that it may shorten the duration of illness. It may make you have less fever. Then that's what's probably conveyed to the family. And family, it is lost in translation. I think family take this on as there's some sort of medicine that is life-saving. For me, if remdesivir is there and the patient meets strict criteria, then I don't mind giving it. But if it's not there, I do not think it is the end of the world. I certainly would not recommend any of my patient family members to go outside and queue and get these medicines, because all these people waiting there, that could itself have repercussions to everybody who's waiting.
So this is very important for everyone to understand. What the doctor is telling us is that it can help, but it's not a life-saving drug. If doctors are also desperate, they are trying every way possible to save lives, which is why they are continuously maybe prescribing these drugs. But don't go out of your way. Do not panic. Do not be frantic trying to get this drug. I mean, don't stand in a line with 1,000, 2,000 people, which can become a new cluster tomorrow. The other question which I would like to, Charlene Maria Lawrence has put out a question. In fact, there's a lot of discussion about this doctor today. She's saying there are numerous articles shared saying post-COVID heart attacks, which is basically somebody gets COVID, they recover, then they get heart attack. Is that really true? There was a death today of a Aaj Tak anchor called Rohit Sardana. He also supposedly had COVID, recovered, and then had a heart attack. So is there any study on this?
We have seen some some side effects of people having Covishield. But I don't remember the numbers off the top of my head, but I think it is something like 1 in a million people getting some clots in the brains and getting clots elsewhere. Now we have to contrast this side effect, which is going to happen to 1 in a million people, versus the chance of death from getting COVID, which is like 1 in 500 or 1 in 1,000. So the chance of you having a side effect is about 1,000 times less likely than you having side effect from the disease. So there is no question at all. Everything that we use, every medicine, every drug that we use has got side effects, and it's a question of weighing the benefits and the risks. And as far as Covishield or Covaxin, the vaccine goes, I think it's quite clear. I want to emphasize this: if you have access to the vaccine, you fall in the group that is available for it, please take it. And the reason is, we have seen a lot of people coming to us now who had both shots of the vaccine and are now COVID positive. And very often we find these people have much milder symptoms And in our experience, nobody who's had the vaccine has gone on to develop severe illness. In fact, when you do CT scans in these patients, we find that their lungs are predominantly clear. The lungs are not affected. They're having symptoms of fever, sore throat, headache, and body ache. But the main worry in the COVID illness is severe affliction of the lungs. So I think the side effects, while present, are exaggerated. Just the sheer numbers strongly justify getting your vaccine if you're eligible for it.
Okay, so doctor, since you joined us on the live again, do you have anything to say about this whole rush for remdesivir? Sorry if I'm pronouncing it wrongly. You are muted, I think.
Remdesivir is an antiviral drug. This viral infection has two phases. First phase, the virus divides, and the second phase, body's immune response becomes exaggerated. When the body's response becomes exaggerated, people go for something called as respiratory failure. That is, a lung function drops and you give them oxygen. So what is the role of giving an antiviral when the body is already fighting against it in an exaggerated form? So anybody becomes sick because of body's exaggerated immune response. At that time, you give something called a steroid. The antiviral drug may not have any effect. So when does this have effect? When somebody is progressing, the small minority may have some benefit from this. There were several huge trials done across the world. They have not found any benefit in somebody who's completely stable or somebody who's sick on a ventilator. Some minority group who's just progressing into mild hypoxia, they may have some benefit in terms of hospital stay. That's it. It's not a life-saving drug. It is not going to change your outcome totally. It's not going to decrease the ventilator days. It's not going to prevent you from dying if you're very sick. So this is a drug which may have a benefit, but definitely not in the ICU setup. So rush for remdesivir is completely unjustified.
Okay, so I want to stress this again, because this is the biggest problem now. This rush for remdesivir, also because doctors are prescribing it. I can understand from their viewpoint, they just want to try everything out. But please don't make a rush for this remdesivir. Don't stand outside lines. Figure out other methods if you really want that drug. Now, Megha has a question. Again, I'm really sorry if I'm going to pronounce this drug wrongly. What is the purpose of tocilizumab in COVID-19 treatment? Is it a life-saving drug? Dr. Sridhar?
Okay, so this is a difficult question because the research has varied a lot. We were not big fans of tocilizumab during the first wave because at that point the research did not support its use. Now there are some studies. The last two studies that have come out, one study supports its use, saying it can be used, and another study has gone on and said that it is not beneficial. Now, how we use it in our hospital is tocilizumab is an extremely powerful immunosuppressant. It stops your immunity from producing antibodies. So we have to be very careful in those who use it. We only use it in a very small subset of people who are extremely sick, who are just come into the ICU in the last 24, 48 hours. It cannot be used, say the patient has been in ICU for 4 or 5 days and then is been sick for some time. It is not very effective. And you have to be certain that this patient has got no other infections, bacterial infection or fungal infection, before you go ahead and use it. I think it's a double-edged sword, and you have to use it very carefully. And we certainly have used it very carefully in a very small subset of our patients. It is not an universal lifesaver. It is not a magic wand. It cannot be used in all patients.
Okay. Dr. Vijayalakshmi, my colleague Shiba has a question. In fact, I have the same question. Many times the patients are being asked to procure this medicine, whether it is remdesivir or this other one that I cannot, tocilizumab. Why is the onus on the patient and the family now? Are hospitals not able to get these drugs? Is there a shortage in procurement?
Yes, the truth is we don't have the drugs, and when somebody is pushed to the corner, you just shift the responsibility to the patients. But remember, it's not just, it's equivocal. Patients' family also, with everybody talking about remdesivir and tocilizumab. I wish we had actually made this happen before and made sure masking went on well, made sure vaccination went on well. That never happened. Now it's only remdesivir and tocilizumab which is doing the rounds. Everybody talks about remdesivir and tocilizumab. And it's so complicated. Even the regular doctors won't understand much. You have to be really working in COVID area or critical care to understand these. These are pretty complicated drugs. And when everybody is pushed to a corner, when a patient is collapsing and sinking, you don't know what to do. Everybody wants to do everything. And that's when your hospital doesn't have a stock, you don't want the patient's family to point at you, and then you give the option to the family. But remember, none of these drugs are life-saving. The only things that helps is oxygen, and probably steroids to a significant extent. It's a viral infection. So we know from the last 100 years, we don't have any efficient drug for any of the acute viruses. We have drugs only for chronic viruses. So there's going to be no magic drug. It's going to be supportive care. So if you get it, there is always a risk you can become sick. The best measure is avoid getting it, so that get vaccinated. If you get it, stay safe and go to a hospital. And some all subset will become sick. No matter what we try, there will be a subset who will become sick. We won't have an option.
So since we don't know when this peak will be, I mean, people are saying it will be May end or it will be June, and how many days this will continue. Do you suggest it is advisable for, let's say, apartment blocks, or even for a few people to come together if they can buy oxygen concentrators, etc.? Would that be helpful?
Well, the point is how to use it, who to use it. It is way too complicated. I think I will leave it to the government. I will leave to the public health people to make sure enough oxygen is available, just that it got overwhelmed in certain areas. But I think we should buckle up and leave it to the government and the hospitals and public health department to it. Individually, if people start hoarding oxygen, and please don't promote it, knowing our country, the rich and the affluent will hoard it, and the poor will die without lack of oxygen. In fact, we're all thinking twice about sending patients on oxygen cylinders, because a cylinder, somebody with 2 liters of oxygen or intermittent oxygen may not use it. And that one oxygen cylinder may save somebody else's life. So we're all thinking to that level. And at this point of time, please don't think about over-the-counter purchase of oxygen concentrators, which may be valuable to save some lives in a hospital. You got it?
Very true. So what Dr. Vijayalakshmi is saying is that this is not the time to hoard, because there will be a lot of people who will need it. They will not have your resources to purchase these things. So therefore, leave it in those counters for those people. When they need it, they can buy. We have a question from Surya Prasad. He's asking, can a person
buy
have
hospitals to buy?
Yes, hospitals also. When a person has undergone angiogram, can he take the vaccine, or is there a gap to be maintained?
Yes.
You can take the vaccine.
Yes.
Okay. Can a patient or person who has COVID-19 currently take the vaccine, or should that person recover fully?
Remember, if you have symptoms, not even COVID, forget, you have some symptoms of fever, very likely you'll have COVID. Or if your family members have some symptoms suggestive of COVID or any infection, don't even go to the vaccine center. 2 problems. You might be having it in a subacute form, or you might be infectious, you may not know it, you may spread to the people around you. Second, when you have the infection in the incubation phase or early infection, with a vaccine, you can fall sick. This is something called as immune hypothesis, where because when the vaccine goes in, it produces some immune response. The virus goes in, body's immune response comes in. It can have an exaggerated form. So we have also noticed it in the last few months that there are people who, when a family member falls sick, they'll stay at home. They'll immediately come and take the vaccine. They would have already got exposed. They'll be in the incubation period. And when they take the vaccine, the fever becomes more. They can have some chest shadows. They can become very weak and sick. And then they'll be talking to everybody saying that it's the vaccine caused it. It's not the vaccine. You already had the infection and you took the vaccine on the top of it. So it is a double insult to your body. That's why you're sick. So don't take the vaccine if you have fever, or even any family member has fever. It can produce a major damage to your system.
So please remember this carefully. If you have fever, anybody in your family has fever, or anyone you have been in contact with closely has fever, do not go to take the vaccine. Doctor, there are 2 questions that I want to ask together. Yeah, Soumya has asked for 2 weeks, you're saying, for 2 weeks. Yeah. Soumya is asking, how badly have children, I mean, what you are observing, of course, how badly have children been affected? Are you seeing more children being hospitalized this time? Kamakshi has a question which adds to that. She's asking, children with asthma, if they get COVID-19, is it more of concern? Are they going to get it more? I mean, I don't know, there's research. Dr. Sridhar and Dr. Vijayalakshmi?
So what we've seen in the adults at least is people with asthma are less likely to get severe illness. This is a very unexpected finding, and I don't think people who have children who have asthma should be more worried that they are going to have more severe complications from the illness. Number of children wise, I think the biggest problem we have is the denominator. The number of people with this infection is very high. So as a consequence, we will definitely find more people, younger people, also getting sicker, and we are seeing that there is an increase in the number of people who are younger and sicker this time, and I think it's because of the huge number of people who are affected, and the small proportion of them who are going to become sick is still a large number because the overall number is so huge.
Dr. Vijayalakshmi, have you been noticing more children coming this time, being brought this time?
The point is, when we had 10 patients, we have 100 patients now. Let's say 1 out of lakh child comes in sick means when you have 10 lakh patients, it will be 10 children. So that's what we are seeing now. We are seeing some children with some pneumonias, but we have not some with multisystem inflammatory syndrome, but that's a very minority. Majority of them are older adults. Only thing is, we're seeing a disproportionate number of younger people, but again, as I said, this is a huge second wave. The size is bigger. The population
is younger people, as in from 30 to 50.
Disproportionate. When compared to first wave, we are seeing more younger people, and we are seeing more younger people because more people are getting infected. Let's say even if it's going to be 5%, that's a huge number.
So what happens if somebody already got COVID? Can you get reinfected with a different variant because there's so many variants now? And is there a time frame for someone to get reinfected? I mean,
I would say it is very uncommon for somebody to get. Okay, I would say it's very uncommon for somebody to get reinfected immediately, at least for 3 to 6 months. Post 3 to 6 months, now we have enough material saying that the antibody response wanes off. At that time, there is a chance you can get reinfected. It may be with a different strain or a variant, or with, even we don't know whether it can be with the same strain also. But the immune response against this virus, at this point of time, we don't have evidence to say that it will last for a longer time. That's the reason we are advocating vaccination even for the recovered.
Okay. So many of the states, Dr. Sridhar, have now said that you don't. Am I audible to you?
We can hear you.
Okay, fine. I don't think my visual is there anymore because my phone fell down and my visual is not there. If my audio is there. So a lot of people are basically asking that what is the I forgot my question. So basically, a lot of states are saying that there should be there's no need for negative testing these days, right? So if someone has a mild COVID, how do they decide that they have recovered from that if there is no negative testing going on?
There was never a negative testing, so please don't make it. Because initially we didn't know.
Kerala, some of the states had initially. They were asking people to do a test again.
Initially. So you have to add the word initially. Initial few months when we don't know what we were doing. Because this RT-PCR does not pick up live viruses. So you don't know whether it's a dead virus or a live virus. So you can have the virus RT-PCR test being positive even for 3 months. So there is no negative test. So testing is required basically for travel simply because you don't have a measure to differentiate. That's it. We don't have anything easier. So if you are positive, if you're going to be at home or anything, 14 days of isolation is mandatory. If you're sick in the hospital, especially in ICU setup where you're on a ventilator, we isolate for 21 days. So if at home, 14 days isolation is mandatory. After 14 days, you meet your doctor. That's in the post-COVID, whichever doctor is looking after you, you're non-infected. He'll make sure you're fine and you can go back to your normal life.
Okay. Dr. Sridhar, Shibi Nandan is asking, what are the do's and don'ts between 2 vaccination doses?
I think just because you have the vaccine does not mean that you're not going to get the illness. If you're going to get the illness, it's going to be less severe and very less likely to need hospital admission. So in between the vaccines and after vaccines, you still need to maintain social distancing as much as possible, and you need to continue wearing your mask. I think if the question is about alcohol, I think the question that we get most often asked in the vaccine is how soon we can have alcohol.
Or smoke.
Yeah, I think you can do it straight. You can walk out with a glass of champagne in your hand. We will not hold you against it.
But just one glass, right? Not like the entire bottle.
It depends on your tolerance levels.
Okay. So a couple of people, including Archana Shetty and others, have asked if someone is tested positive, within how many days can they take the vaccine?
1 month. One
Okay.
month, minimum 1 month. If you've got a
Hmm.
pneumonia or something, ask them to take it 1 month after recovery, because we want the immune system to be good because the vaccine has to respond. So if it's a milder infection, no lung involvement by 1 month. If you've had a pneumonia, 1 month after recovery.
Okay. My quick question to you is this. I mean, I'm personally confused about how many masks to use, what kind of mask to use. Tomorrow, I'm supposed to go and do an interview of the BBMP commissioner. How many masks should I wear? And is N95 compulsory plus a surgical mask? What should I be wearing?
Regular 3-ply mask or a double layer cloth mask is more than enough. We've been having this epidemic for 1.5 years now. And
So
suddenly
N95
somebody
is
will say
not.
to us, N95 is required for medical professional, because see, it is N95 wearing is not like putting it on your face and then roaming around. It has to be fitted. You have to have it in the same position for a long period of time, and you should wait to understand how difficult it is. It is difficult breathing through it. So wearing an N95 in your neck will not work. Wearing it loose, it's not going to help you in any way. So
Hmm.
N95 is difficult to wear. So wearing some mask or properly, then wearing some mask with difficulty, there's a difference. Because if it's going to be difficult, you're not going to wear it continuously. And it's not going
Hmm.
to help you at all. Next, this double layer mask was based upon some weight trial which came in very late, and based upon it, the CDC again talked about it. We had this, wear 3 masks, your viral load again it's going to be lesser, or 4 masks. People are not even wearing 1 mask. You're talking about 2 masks in N95. It doesn't make sense at all. For a common public, no nylon mask, no fancy mask, a 2-layer cloth mask or a 3-ply mask is more than enough. For the medical professional who are going to treat COVID, a proper N95 mask properly fitted. That's more than enough. This is what WHO suggests, and this is the proper suggestion. Don't get confused at all. There will be
So the reason
trials after
why.
trials, there will be differences. It has to be
Correct.
applied finally.
So reason why I'm laughing like a maniac is that there are at least 4 people on this live who I forcibly made them buy N95 masks, and I told them you have to wear N95. So immediately after this live, they'll be telling me to reimburse that money, which is the reason why I'm laughing.
No
Uh,
problem. Wear it for 1 hour and tell me if you can do it. I'll be very happy.
okay, doctor, what about blood plasma? Like remdesivir, there are researchers which says that blood plasma also may not be effective in all cases, but we see people scrambling for blood plasma again. Could you explain this to us?
Once again, I would like to emphasize remdesivir is not going to save lives. You don't have to run around and break your head or feel guilty if you're not able to get tocilizumab or plasma. I'll give you an example. We all say that steroids are life-saving in COVID patients who are oxygen levels are less. This is undoubtedly true. All the studies have supported it. But let me give you an example. If we treat 20 people who are needing oxygen in COVID wards with steroids, one of them will benefit. Okay, that is how less effective or effective one of the best drugs that we have is in COVID. So let me re-emphasize: if you have 20 patients, all of whom need oxygen, and you're not able to give steroids for all 20 of them, only one of them might suffer the consequence of this. Other 19 will either get better or will get worse, depending on whatever is fated by their immune reaction. Am I making myself clear? Even for a
Yes.
life-saving drug, even if you give it for 20 people, only one of them is going to benefit. Now you take this less proven life-saving drugs, they're going to be less effective than this. So I don't think anybody should be rushing around trying to source remedies like remdesivir or plasma to try and save their loved ones, or feel guilty they're not able to get it. Plasma may or may not work. If it is to work, it has to be given very early. But if you're giving it very early, they're not very sick. So I have never prescribed plasma for any of my patients. I have done it on 1 or 2 occasions where family members have strongly insisted they want plasma to be given, and they have arranged it for themselves. I have never told anybody, even the sickest ones in the ICU, that we should try and give plasma as a last ditch resort. Have I made myself clear?
Yes,
you
Sridhar,
have.
somebody is going to say that there are no medicines for COVID and allopathy, so we'll go to Ayurvedic or we'll have some other Siddha medicines. It's going to come to that level.
But since you mentioned the doctor, okay, doctor, continue.
It's a viral illness. So we have never had effective medicines for viral illness. That doesn't mean we are not treating them. So everybody thinks that if it's an infection or if it's any fever, one antibiotic, one magic pill will cure it. Treatment is never that simple. And one size of dress doesn't fit everybody. So somebody will get a particular type of oxygenation, somebody will get it a different type, somebody will get fluids, somebody will get fluid restriction, somebody will get steroids at a lower dose, somebody will get it a higher dose, somebody may not get steroids, somebody with anticoagulation, lower dose, higher dose. See, there are so many variations, and it is a very complicated subject. The only problem is what we have studied for 10, 15 years. Everybody wants to understand in 10, 15 minutes, and they want a single fit and a single magic pill for cure. It cannot happen that way. And please don't take it as if we don't have treatment. This is a treatable condition, and we are treating it, and we are saving lives every day. And it's not as simple as it sounds. There is no magic single pill.
But I want to actually pursue on this question one more time, also because I'm a journalist. Is there a wrong message being sent to the public here? The government is organizing counters for remdesivir. Government is saying give blood plasma. There are banks. So there is a lot of miscommunication, right? That people think this is very, very important, or their family or friends cannot be saved. Has a wrong messaging been imbibed too strongly?
See, this is a disease which we didn't know much about. We are learning every day, and we really want to give every option to the patient as possible. So everybody is trying their best. So certain things we are overdoing, certain times we are underdoing, and there is nothing perfect. So I wouldn't say anything is wrong or anything is correct. So as you talk from masks, somebody is talking about airborne, droplet, masking, cleaning. Nobody knows. We are learning every day. As we learn, as the information comes in, we're disseminating it. Shrida, please add on.
So I think we all have to realize that this illness, we know the whole world has been introduced to this only for the last 1.5 years. So a lot of treatments are still experimental. So what happens is medicine is not just pure science. So we are dealing with a family that is under a lot of stress because their loved one is lying there extremely sick, and then they and the doctors, both of them, want to say, is there anything else we can do? We have given the standard measures. Is there any chance experimental therapies might work? At which point people say, right, the ones that we are experimenting are all these antiviral drugs, this convalescent plasma, tocilizumab, they're all experimental therapies. We do not know if they'll work, but as we're trying to do everything, let us try and give this a chance. So I think it must be emphasized that these are not proven therapies. All these are experimental therapies. It has got to the point wherein I've had people who have said, doctor, I believe that giving my loved one who is sick with COVID and is in ICU, I believe giving them Siddha will work. What do you say to them?
You don't want to stop them, basically.
Correct. Because later on, if the patient dies, then I don't think that they should have the guilt that, maybe if I had given Siddha, like my friend had Siddha and he got saved or she got saved, maybe if I had given them Siddha, maybe this person got saved. So although I don't necessarily believe in it, in desperate situations, it does not boil down to pure science. I, for one, do not think that, I think whether the patient gets better or not depends to a large extent on the genes and the immune response. And we do have standard proven measures like Vijayalakshmi was saying, oxygen, steroids, low molecular weight heparin, adjusting the fluids, ventilators in various forms, high flow oxygen. All of these are therapies that help patients get better. But when people are deteriorating despite all these measures, then experimental therapies are being offered by doctors and accepted by patients, attenders who are trying to save their loved ones.
Dr. Vijayalakshmi, Namita Singh is asking if someone is COVID positive. No, she's asking, if someone is COVID positive, are there home remedies? Is there anything that people can do at home to help these patients, to help these people?
See, first we'll talk about things which has got proof. They just looked into 50,000 people across, and they found out people who are active, physically active, some kind that is physically active, the minimal duration is somewhere around let's say 3 hours of physical activity per week minimum. The more active you are, the less chance of you getting severe COVID. Those were very active, good respiratory function, didn't get bad COVID. And a balanced, good diet, a very active lifestyle, despite being in quarantine, probably will prevent a chance of a severe COVID. Control sugars, your good body mass index, not obese, a good control of BP and other risk factors will definitely have a good benefit in controlling severe COVID. Beyond that, taking even vitamins, we don't have solid evidence. Neither do we have evidence of any of these other remedies. So a balanced diet, active lifestyle, that's it.
I have been asked, somebody told me to eat one zinc tablet a day, then we are taking vitamin C. So are you saying that that's all not?
So 1.5
that's all
years,
okay?
expect me to take my zinc and vitamin C for 1.5 years. I can't. I have not been. And I've been seeing COVID for 1.5 years now.
Somebody is going to call me the non-medical doctor soon. I'll step in and say what you expect me to say. Vitamin C and zinc don't work. See, I'm really sorry to say this. It's almost boring, really. The things that work are you taking care of yourself, what you eat. Please, we always find, if I find a patient who is extremely overweight and coming in severe COVID, we worry about them. Don't we, Vijayalakshmi? When we see somebody who is overweight, our alarm bells start ringing. When I ask somebody how were they before coming to ICU, were they very active, were they or were they very inactive? They say they're active, then I feel much more confident in treating that patient. The things that have always been under control are our activity levels and the food that we take. And these two are, almost so well known, they're boring, we ignore these. And once again, as Vijayalakshmi said, we ignore the important thing, which is masking and social distancing and taking the vaccine. So these are the ones that are really going to save large numbers of lives, not this small fraction of lives that experimental therapies may or may not change.
Doctor, there's a lot of people are continuously asking one question that actually somebody has written they lost sense of smell and taste. Should they go and do a COVID test? But they don't have any other symptoms.
Can present that way because if it's going to be only an upper tract and if you're young, you may just have a loss of smell and taste. Remember, it doesn't happen early. It happens around probably 5 to 7 days into illness. Sometimes even your tests may be negative around that time, but still you need to isolate for a week at least after that. Loss of smell and taste at this juncture is definitely COVID. So isolation becomes important. You may not have anything in the CT. You may not feel sick also. You'll recover.
Okay, I'm just going to read the last few questions. One person is asking, how many waves do we expect?
Yeah, I would say at least 2 more. I'm not sure it could be more than that. See, basically hope it's not a big wave. When we say a wave, it's like the second wave is bigger than first. See, and probably the second wave is around 2-3 months after the first wave, third wave maybe 3 to 4 months or even up to 6 months after the second wave. We will have few more waves. Till this particular virus becomes endemic. See, this virus has to learn to live with us. It has to become more infectious and less virulent.
We have to learn to live with it.
Yeah, whichever way, both ways. So basically, the virus will become something which lives with us, causes like a common cold-like thing, and doesn't kill most people, and maybe will kill a small proportion of immunocompromised. And that's the stage; it will not be big. You may have few more waves, and if the vaccination is good, it may not be a big wave; it will be a small wave. Even in our country, the second wave would not have been this big if we had taken the vaccination. In fact, we had a previous live on that because we told categorically even at the time there will be a second wave. If we had vaccinated ourselves well, it would have been a smaller wave. Now we have a bigger wave. So with the vaccines coming in, maybe the next few waves will be smaller and then things will settle.
For everyone who's below 45 years of age and watching this live, I hope you know that most state governments have not got vaccines. It will take another 2 to 3 weeks or maybe 1 or 2 months. So you have to be careful, mask up, not go out too much because that's the only way. Like Dr. Vijayalakshmi has been saying, vaccination is the only way out of how many more waves we see, second, third, etc. Dr. Sridhar, one important question a lot of people have been asking is someone gets the first dose, whether it's Covaxin or Covishield, there is a gap because there's shortage of vaccine. How much longer can they afford to wait for the second dose?
I think for Covishield, at least, which is a vaccine that we are predominantly administering in our hospital, even waiting up to 3 months is all right.
See, basically, like you have this first and second shot. First shot produces some amount of immunity, and you need to take the second shot as a booster. The second shot ensures the immunity stays for a longer period of time, the immunity goes higher up. That's it. So your protection starts roughly around 2 weeks after the first shot. It slowly increases, may reach a peak by around 6 weeks, and then starts slowly going down. So a second shot taken by around 6 weeks to 12 weeks will augment the response and keep you immune for a longer period of time. If you don't take the second shot, your immune response will slowly start going down. By 6 weeks to 3 months, your immune response may be lower, and you will have to probably end up taking 2 shots, another shot again. The augmentation of response may not be good. So with the lack of vaccines, anywhere between still by try to take it by 6 weeks, anywhere within 3 months. If it crosses 3 months, just a booster, will it work, or whether you have to take another shot? I'm still not sure. We don't have research yet. But then anytime within the first 3 months is pretty good. I guess it should be the same for both Covaxin and Covishield.
Yeah, we're all right.
There have been countries which are talking about giving everybody one shot, because even with one shot, severe illnesses goes down. Assuming that you do it en masse across a lot of people, the chance of getting severe disease goes down, and as more people get immune, the chance of the spread also goes down.
Dr. Sridhar, you wanted to say something?
Yeah, 3 months is, we can wait up to 3 months.
Okay. So this may sound very pedestrian, but please remember, Anna was supposed to do this live, not me. So I have a question. If somebody gets 2 doses of the vaccine, is the immunity coverage for a certain period, lifelong? What is it now?
The real answer is we don't know. Basically, what we know is the immune response is at least stay for 6 months. By 6 months, there can be strain variation. This immune response may stay lifelong also. It may start waning also, because after an infection by 6 months, a lot of people, some of them had with repeated responses augmented immunity. Some of them had fallen immune response by 6 months time. So as of now, we are not really sure. What we know is unless there is a very typical strain variation, they should at least stay well for at least 6 months minimum. By 6 months, there is either the vaccine strain will change or immune response will fade. So I don't know.
This definitely doesn't sound very happy to me. Doctor, so one question which people are asking, and maybe like you semi-shouted at me for the mask question, you should do the same again. What if you have a family member who does not want to take the vaccine hesitancy, especially in Tamil Nadu, it's quite a bit more after Vivek's death. What would you want that family member to be told?
See, basically, I don't know how to put it. I think if somebody wants, you can come to our ICU and see how, or our ER. See, this time it's really bad. We have a lot of people are very sick on the ventilators, not getting ventilators. Death has been higher. People are falling sick. If you still don't believe in this disease, if you still don't believe in vaccination, I just don't know. Because there are pictures coming out about funerals and stuff. At least now you should believe in vaccine and go ahead with this. Because we have seen countries surviving. Israel literally turned around. We've seen what has happened in UK and US. I don't know what to say to people if they don't want to believe in vaccine. Sridhar?
Yeah, I think countries like Israel, which have undertaken mass vaccination programs, are now so confident. They're all mask-free now, and they're doing well. And we have seen that as the vaccination uptake among the population goes up, the severity of illness and the number of people falling ill comes down. So we want to talk about this. We want to wait till people fall sick and then running around medicines that may or may not work, rather than take a vaccine that is available. So I think we should, if our elders start behaving like children, then we should indeed treat them like children and take them to the vaccination center and possibly give them a lollipop and get the injection done.
Well, that's a good suggestion. So I'll do 1 or 2 quick questions before we wrap up the live. One question is, let's say if someone takes Covishield or Covaxin in the first dose, they have to stick to the same vaccine in the second dose, right?
Yes.
The other question somebody has asked is, let's say you've taken a vaccine 2 shots. After a year later, can you take another vaccine?
Yes.
Yeah.
Which is, I take 2 Covaxin, after 1 year, I can jolly well take Covishield.
If that's the only thing available, yes.
Okay. Many people are again and again asking, if you're in contact with someone who's COVID positive, you yourself have not become COVID positive, should you still wait for your vaccine shot?
Yes. See, basically, because there's something called incubation period. After exposure, the incubation period is till 14 days. So if if you had a single exposure with your family member, and if you can isolate yourself by around 5th to 6th day, around a week's time, you test yourself. If you're negative, then you can go get vaccinated. If it's a continuous exposure, please wait it out for 2 weeks. Make sure you don't have any symptoms. If family members recover, then go get your shot. Getting a shot when your family member is sick, it's like you yourself entering into a big problem, because what happens is if you're in the incubation period, you're going to become really sick.
So please note, if anybody in your family or your circle has COVID, do not go and get the vaccine at that time. Please wait for 2 or 3 weeks to get the vaccine. Anyway, we don't have vaccines, so it's not like it's a great thing you can afford to wait now.
Hey, I
Doctor,
thought we were
before
doing the doom and gloom thing. Now you're starting to do it.
No, but I'm smiling and saying sad things. There is a difference here. I'm smiling. I've now become used to that. I say sad things smiling. Doctor, my last question to you. We have answered almost all the questions people have given us. But I want to ask you, as two doctors who have been working ever since March 2020, how difficult has it become for you? I mean, what is it that you are actually dealing with every day? Can you tell us? Because I think many times we don't understand what doctors go through. I see a lot of anger at doctors, medical professionals, even people at vaccination centers, when many times it's not even it's not their fault. So what have you all been going through in the last 1 year and 2 months?
Sridhar, you take this first. I don't know what to say.
Well, it's a roller coaster ride. So, for example, day before yesterday, I sent a very sick patient home. So they were very pleased, and then we took selfies together, and they were very happy, and they gave me lots of presents to show their love and affection, and it was all happiness and smiles all around. The very next day, one of our patients who we knew was not going to get better because they had an untreatable cancer came to us with a severe breathing problem, and we did an RT-PCR, and we found out that the patient was positive. And then the patient died 2 days later, and the family were very upset and shouting at me for having done an RT-PCR on somebody because they could not carry out the funeral rites. So we are used to oscillating between gods and demons on a pretty daily basis. But hey, just like everyone else, we're just trying to do a job. Slightly harder than what others do, but in the end, I would like to say this. There have been a lot of failings from various aspects, the public, the government, but let's not go into it. But let us not forget the various people who are out there risking their lives for us day in and day out. And it's not the doctors. It is the administrative officials. In Tamil Nadu, I have people, friends who work in government healthcare setups who go in at 6 o'clock in the morning and come home at 10, 11 at night, working really hard. Doctors, administrators. Even now, I just heard that the Tamil Nadu government is opening another few hundred beds with oxygen in it. All these are huge hassles which the government is proactively undertaking and trying to open it. And then let's not forget my nurses and the people who keep my ICU clean. These are people who come in and deal with infectious material almost on a daily basis. They do 12-hour shifts. And even now, even today morning when I went in, I saw one of my healthcare workers, she's not a nurse, taking the mask off somebody with COVID, and very nicely, like you said, with a smile on her face, entreating this grandmother, calling her grandmother, not by her name itself, calling her grandmother, and encouraging her to eat a couple of idlis more. And there's the situation where even family members stay away from infected people, and this girl had taken the mask off and was trying to stay close to her and feed her. So it is a lot of focus happens on the negatives that happen, but let's not forget that not all heroes wear capes, and there are a lot of people who have done extraordinarily good work and are continuing to do good work. And as doctors, we do tend to get a little bit more glory than we should, but there are a lot of other people who are doing equally good work and not getting recognition, and I'm grateful to be working with them.
Dr. Vijayalakshmi?
I don't know. I've been a doctor for 21 years and I've seen more deaths probably in the last 1 month than I've seen in the last 20 years. I'm very tired. I've had people in my family falling sick, my friends falling sick. It's tiring at the end of the day, starting the day in the morning and going on till night. I want my life back, so let this end soon. We don't have a life now. It's just patience, sickness, somebody becomes all right, and you have to be being the head of the department. You need to maintain you have to feel happy, you have to show them only everybody sees death, it's not just you, the housekeeping person, the nurses. So you have to show them the positive cases, keep up the morale, but at the end of the day, I'm tired. Wear your mask, get yourself vaccinated, come out of it. I've had enough. I can't handle it anymore. So we're all holding for 3 months, holding for July to end, and hopefully by then this epidemic will be over. Please,
I
please
really
follow
hope
the
so,
rules. We are tired. We are really tired.
So that's what the two doctors and even the journalist who does 1/10 of the work that they do is telling you, that everybody's tired. We have to ensure that we mask up, that we get our vaccinations. Otherwise, there is no end to this chain. We will see more waves. We will see more people falling sick. And I mean, I can feel it coming closer and closer. I sit in Bengaluru, and we are, of course, helping volunteer groups. And I know in the last 2-3 days, we are getting so many messages from Bangalore and Chennai of people looking for beds, people looking for oxygen. So don't think this is happening far away in Delhi and Uttar Pradesh. It is coming closer even to us. Let us be careful. We cannot keep burdening the health system more and more. We have to do our bit. Also, we can criticize the government, everybody else. Yes, that will go on. But we cannot be doing that if we don't do our bit. Thank you very much. And I apologize once again. Anna, who's our in-house expert, was supposed to do the interview, but her connection got disconnected. So if my questions were not up to the mark, I'm really sorry. But I hope it went well, and thank you very much.
Thank you. Thank you.